At Evernorth Health Services, we believe costs shouldn't get in the way of life-changing care, and we're doing everything in our power to make it possible. Behavioral health solutions that also keep your projections at their best? It's possible. Pharmacy benefits that benefit your bottom line? It's possible. Complex specialty care that cares about your ROI? It's possible. Because we're already doing it. All while saving businesses billions. That's Wonder made possible. Learn more at evernorth.com/wonder.
Many of us are familiar with the idea of crowdfunding. Companies like Kickstarter help to get creative endeavors off the ground by letting strangers like you and I donate to various startups. In 2010, the platform Gofundme was one of the more prominent websites that encouraged people to donate not to companies, but to individuals.
And took a fair amount of time to kind of gain a lot of popularity. But by about 2014, 2015, we were seeing this pretty astronomical rise in the use of crowdfunding. And in particular, crowdfunding for medical needs has been very persistently the most common uses of this type of charitable crowdfunding.
That's Nora Kenworthy, associate professor in the School of Nursing and Health Studies at the University of Washington. She researches how corporations and philanthropic capitalism shapes global health programs. Kenworthy notes that GoFundMe has been extremely successful over the last decade. Earlier this year, the platform announced that their campaigns have generated $30 billion since they began in 2010. Kenworthy says companies like GoFundMe create a sense of community and fill a need left by our fractured healthcare system.
It's not just that we often don't have enough health insurance coverage or enough savings to cover our medical bills, but that, when you're sick with cancer or something, you probably are also facing transportation challenges to get to the center where you get chemotherapy. You might also need help with childcare or just covering basic bills while you're out of work. And so crowdfunding is a really easy way to sort of address some of those needs that tend to arise and really take people by surprise a lot of times when they are falling sick.
Online crowdfunding also creates a simple avenue for anyone to be able to help, even from the other side of the world.
I think most Americans, most people are very helping. They want to help each other. They want to connect with each other. When they see someone in need or someone in crisis, when they see a really tragic story, they do want to find some way to reach out and help. And crowdfunding just offers this incredibly easy way to do that.
However, crowdfunding isn't a perfect solution. In fact, in her new book, Crowded Out: The True Costs of Crowdfunding Healthcare, Kenworthy argues that it may be the exact opposite. Instead of being a shining beacon of hope, these platforms may be the crystal clear evidence of America's failing health system. This is not an attack on crowdfunding platforms. Their presence has helped so many people. It is, however, a recognition that they're not as strong of a safety net as we need, and they shouldn't have to be. Kenworthy says we should be able to fully rely on our healthcare system. Unfortunately, that's not a possibility for many of us. America treats healthcare like any other market, with the idea that competition will drive down price. But it hasn't worked that way. Millions of Americans are still uninsured because they can't afford it. So why isn't the healthcare marketplace acting like all the others? Kenworthy says consumers' lack of knowledge is a big factor.
So what we call that in the sort of health policy field is information asymmetry. What that means is that healthcare providers and those who are selling things on the healthcare marketplace often have reams and reams of data about us, but patients themselves often don't have a lot of data. So for example, some of the policy initiatives that the Biden administration has been taking on, for example, price transparency, right? These are efforts to chip away at that information asymmetry that affects patients.
But price transparency won't balance the system because the second factor that sets the healthcare market apart is that its consumers are sick and often desperate when they need these services.
You think about someone who's like suddenly had a heart attack on the street and is being picked up by EMTs and taken to hospital. Like they're in no shape to shop around for the best prices or figure out how much this ambulance ride is going to cost them versus transporting themselves somehow to the hospital, right? So a lot of times when we're sick, we're really not capable of doing the kinds of basic consumer behaviors that we would expect if we were like at the grocery store and shopping for milk.
An additional aspect to this difference is that most of us aren't routinely shopping for medical care like we do clothes or food. So we're not used to seeing prices for medical equipment and services and don't realize how the costs can be dramatically different depending on the institution and location.
And then finally, we have a lot of monopoly effects in the healthcare market that pretty much go unchecked. And so the ability, for example, of pharmaceutical companies to control prices because they are the only producer of specific kinds of medicines. They have these long-term patents that prevent other people from producing similar or generic medicines. So all of that contributes to these incredibly high prices that we see in our healthcare system, as well as the decreased power of patients to actually influence how much they're paying.
And so as healthcare costs continue to rise, many Americans are forced to seek alternate options. And though crowdfunding sites have tried to step in, they're not effective enough to truly fill the current healthcare gaps.
Repeated studies that we've conducted have found that 30 to 40% of campaigns around medical and health needs are often raising $0 whatsoever, no donations.
Kenworthy's recent paper published in Living Maps Review reveals that 9 out of 10 campaigns don't meet their financial goal.
I think we've really been sold on this story of viral success. Like if you have a need, you just write a really compelling story and you put that out there and Taylor Swift's going to find you, or, the newspaper is going to cover it. And before you know it, you're going to have tens of thousands of dollars and you're going to be able to pay off your medical bills. And that is true for a very narrow slice of people on these platforms. The more general experience of crowdfunding is one of fairly small earnings, if anything, a fair amount of disappointment. I talk to a lot of people who feel profound shame about having to place their needs online, in particular when they put their needs out there and then don't get what they actually need in terms of help.
Even some of the people who have successful campaigns don't have a happily ever after. Kenworthy says there are some downsides occurring because we're throwing money at a problem without fixing the root causes.
I talked to a fair number of people in the book who actually did quite well with campaigns as well. It seemed really important to capture their perspectives as well. But among them, there was a well-known musician who raised $15,000 after he was diagnosed with type 1 diabetes. And yet, when I interview him, he's living in a trailer with his entire family, talking about how hard it is for them to stay warm in the winter, because even despite how successful his campaign was, it didn't fully bring him back to financial solvency. And he was still uninsured, struggling to get insulin.
In addition to the low percentage of successful campaigns, Kenworthy argues that crowdfunding creates a power dynamic where a group of strangers decide who deserves to have their needs met. She calls it selective deservingness.
What's happening with crowdfunding is it's kind of feeding off of that implicit notion that we have as a society that certain people are more deserving than others, and then just kind of throwing it out to this kind of anonymous crowd and to the realms of algorithms and social media platforms and media coverage. And all of that kind of amplifies these existing notions of deservingness and undeservingness. One of the reasons that I talk about things like selective deservingness in the book is because I want people to think about how crowdfunding is really reinforcing this idea that you and I should be able to choose who gets healthcare and who doesn't in this country based on a pretty short description and a picture online.
Again, crowdfunding itself is not the problem. However, it can worsen the issues with our already fragmented system when it becomes someone's main source of healthcare funding. The book Crowded Out is available now wherever books are sold. You can find more information about Nora Kenworthy and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
Our bodies come in different shapes and sizes, so doesn't it make sense that our weight loss plans should too? That's the beauty of Noom. They build a personal plan that factors in dietary restrictions, medical issues, and other personal needs so your plan works for you. Noom doesn't restrict or shame when you want to treat yourself. Their flexible program focuses on progress instead of perfection. You don't have to give up carbs or anything. And with their daily lessons, you can learn something new about your food choices every day. After just a few days of using the app, I learned how to recognize cues for overeating and how to choose the right foods to feel full. Stay focused on what's important to you with Noom's psychology and biology-based approach. Sign up for your trial today at Noom.com. That's Noom.com. And check out Noom's first ever cookbook, The Noom Kitchen, for 100 healthy and delicious recipes to promote better living. Available to buy now wherever books are sold.